You've received the COVID-19 vaccine. The question becomes, what is next for you? Infectious disease specialist Dr. Kristen England with the Cleveland Clinic joining us live again this morning with the answer to that question and also some more information on the variants we're seeing out there. So first of all, always a pleasure seeing you. Thank you for joining us once again this morning.
Good morning.
Good morning to you. I think, the first question so many people have, I got the vaccine, I got both doses, and now I just want to get out. I don't want to wear my mask. I want to go visit my loved ones. What are your thoughts on that? And what are you seeing with that?
So it's not time to put away your masks yet. Certainly once you've gotten your vaccine, it's time to celebrate. It's really something that you've done that's important for you to protect yourself against the infection. But we also need to make sure that we're protecting those around us. There's not enough data to tell us yet that even though you've been vaccinated, you can't still get exposed to the virus, maybe carry it in your nose or your mouth and be able to pass it on to someone around you who's not been vaccinated. So certainly for a number of reasons, we need to continue wearing our masks and social distancing, washing our hands and protecting all of those around us.
Now, I know one of the hot topics, the debates that has most recently come out is the question of the double mask. Is it more beneficial? What are your thoughts on that? Do you think we should all have two masks on at all times?
Well, I think it's important to remember that not all masks are created equal. We've all seen some absolutely beautiful, fashionable masks out there with sequins and silk and all kinds of things, but that's not the same as your good old-fashioned surgical mask or the N95 masks or simply a cloth mask that's got two layers with it. So I think it's important not necessarily two masks, but making sure that the mask that you're wearing has appropriate 2 or 3 layers of cloth in it. And that's going to provide you with excellent protection.
We were hearing from a former CDC director not that long ago that possibly the bigger concern would be making sure everyone at least has one mask on versus worrying about others doubling up or tripling up on things like that. Would you agree?
Absolutely. Not only that everyone is wearing a mask, but everyone's wearing a mask correctly. We've seen plenty of people, you've seen them, where they're wearing the mask down around here or off one ear loop. Come on, if we wear them all correctly, the mask that you have can be effective.
Another debate that seems to be coming up, or people asking questions about, is when it comes to immunity, is there longer immunity if you've had the COVID or had the virus itself, or is there longer immunity after getting the vaccine? I mean, there's still so many unanswered questions on maybe how long this vaccine would last.
So if we look at the natural history of other infections, we certainly know that natural immunity tends to last much longer than a vaccine itself because you get a wide variety of antibody responses and other immune responses with the natural immunity. So we certainly believe that people who have had COVID-19 are protected anywhere from 5 months to 6 months at this point in time, or even longer. We don't know how long the COVID vaccine is going to last. We've only had it around for a number of months, so time will tell. Hopefully it will last us longer than we anticipate, but it may end up being a yearly vaccine. We just don't know.
And then when it comes to, we're hearing about the variants out there and then wondering, is this vaccine really going to cover that variant? What should we be thinking about when it comes to the variants? Should extra measures in place on our part? Because some, we're hearing they could be more contagious, easily picked up, more so than the one we've already seen.
So it's important to remember that the measures that we have in place are still very important. Again, we talked about before about keeping up your masks, not only because you could be infecting others, but there are variant strains out there. So we understand that the variant strain from the United Kingdom is about 1.5 times more infectious. So if I could normally infect 2 people, with this strain, I could infect 3 people. So that's going to make this virus spread a lot more quickly. The strains that we're seeing coming out of South Africa and Brazil, we're still learning about those. We think that they're probably going to be more infectious, but does that translate into more deaths? We don't know. The more people that get infected, you assume that there will be more deaths, but is it in itself more deadly? We're still learning more about it. But with these variants out there, do we know that the vaccine can protect against them? We don't know that either. Studies are still coming out looking at that, and the drug companies are looking to make potentially booster vaccines against these variants. But the more people that get protected, the more we protect each other with masks and social distancing, the more we can keep these viruses from spreading and more variants from developing.
The only thing we can help is what's in our control, right? And, we do see numbers locally going down. That's great news to hear. We just have to keep up with all these measures and hopefully continue to see those numbers drop. Dr. Kristen England again joining us from the Cleveland Clinic, infectious disease specialist. We appreciate you always joining us and taking time out of your morning to help us out here.
Thanks, and be safe.
You too. You too.